Good afternoon. Welcome to Mindfulness 101. My name's Lori. I'm one of the chaplains here, and we are very thankful to have Dr. Benjamin Andrews here with us today to speak with us. I'd like to begin just with you taking a breath. You've come here, it's 2 o'clock, it's the middle of the afternoon, this session is about mindfulness. If we just still our mind, sit comfortably, and take a breath. It's something so simple, but so often we forget to do that. Isn't that true? Just as we need food for nourishment, and just as we need community, we also need something to nourish our mind. We think of mindfulness as food for our mind. I think the concept becomes a little bit easier to grasp. I wanted to talk a little bit. I'll let Dr. Andrews introduce himself. But just a lot of times we get asked the question, what's the difference between mindfulness and meditation? And that's on your handout. Mindfulness is a quality. It's a quality. It's where we're paying attention, where we're experiencing the moment. And meditation is a practice. So if you think of mindfulness as that awareness that arises through paying attention on purpose, in the present moment non-judgmentally, then meditation is a practice where an individual uses a technique on focusing the mind on a particular object, thought, or activity. So we'll begin with Dr. Andrews will introduce himself. And before I begin, because we read this at every gathering in the auditorium, in the event that a fire alarm sounds, and there was one earlier today, please remain in the auditorium and stay seated. And if there's a need to evacuate, a staff member will direct us how to leave in an orderly fashion. And remember not to use the elevators and to go outside to a red pole should we need that. And I am thankful to Dr. Andrews, who is a consultant through our Springmore Health Clinic. And I will let him introduce himself to you now. Thank you, Dr. Andrews.
Thank you. So hi, everyone. My name is Dr. Andrews, or just Ben. It's really nice to be here with all of you. As Lori mentioned, I do work here 1 day a week in the health clinic and meet with residents doing kind of traditional talk therapy, and I actually work for a bigger company called Team Health that sends me around to a lot of places. A lot of what I do as a therapist is in the world of mindfulness. Actually, I use a style of counseling or therapy that's called cognitive behavioral therapy. And lately, probably in the past 15 to 20 years, mindfulness has become a major part of the way that therapists and counselors think about taking care of ourselves mentally, emotionally, and physically. And so we'll be talking about some of that today. Another thing that I do a lot of with people is I specialize in working with people whose religious identities or beliefs or spiritual practices are really important to them and want to know that someone they work with in counseling would understand and respect that. So that's another part of what I do. And that also relates to mindfulness because mindfulness connects us pretty quickly to a lot of spiritual practices and is pretty connected to the way that we live as human beings. It certainly has some major tie-ins. So we'll talk about a little bit of that as well. One little thing about me, if any of you have the chance to get to know me, I am really excited about my little 3-month-old daughter, who, if you want, I'm always happy to show pictures of and talk to you way more than you wanted to know about. And we have a wonderful, fluffy little dog, and I love to read. And I mention that both so that you can get to know a little bit about me, but also because mindfulness as a whole way of being enhances my ability to enjoy those things and appreciate them. It's about, as Lori mentioned, being present. And when we're present to the things that matter most to us, it fills our life with a deeper sense of joy. And so it's an example of how we can use that well. So let's talk just a little bit about what mindfulness is. I mentioned earlier that it has really caught on in the past 15 to 20 years. And it's not just caught on in the mental health world. It's actually a cultural zeitgeist. I don't know if any of you are familiar with the book 10% Happier, but it's a book by Dan Harris, who I think was on an ABC News anchor. But there's a lot of other people who have really popularized this idea that mindfulness is kind of a ticket to a happier life. And there's a certain amount of truth to that, and I definitely want to emphasize the ways that it can be beneficial. But I think there's also ways that we can engage in mindfulness that aren't as helpful. And so I want to guide us hopefully towards those things that are going to be the most useful for all of us as we're trying to do this. One of the nice things about being a therapist is the fact that I am, as a fellow human being, like I have to practice what I preach, and if I don't, my own life gets worse. So the joy of teaching about mindfulness is that I can do so knowing that this is something that I use in my own life, and I actually find it to be fairly beneficial for myself, and I can really believe that it can be helpful for you all as well. Now, so I'm just curious, how many of you are familiar with mindfulness already or practice some type of meditation or some skill that allows you to be more mindful? Okay, yeah, a few of you. What comes to mind when you think of mindfulness? Calmness? Awareness, yeah. What else?
Is it awareness of you or awareness that you know someone else that needs help?
Oh, that's a great question. So mindfulness can actually connect us to both. At its most fundamental, mindfulness is about being aware of the present moment. And so if I'm aware of myself, that's always going to be part of mindfulness, but that might also make me more aware of other people around me and what they need. It can do both. I don't know if that answers your question. But.
When you work here once a week, you said,
Mm-hmm.
do you work with specific residents? To help someone?
I do, yeah. Maybe I can talk about that more towards the end. I think there will be a little time for questions at the end. And so, yeah, if you have questions about that, I'd love to speak to them at the end. Yes?
It seems to me that mindfulness really is brought to the fore because of technology and cell phones. You go in a meeting, you sit down to talk to somebody, and mindfulness is turning your phone off and concentrating on the person you're with, or the surroundings and the whole thing. And, 30 years ago, we didn't have all those distractions that we needed to really think about being mindful. That's what I was saying.
Yeah. So that's actually a very insightful comment. So technology and culture have changed in such a way that we are, at this point in history, we're probably less mindful than we've ever been throughout life because we have so many more opportunities for distraction and kind of tuning out. And that can be through phones, through television, through internet. It can be through any number of ways that we try to kind of get away from the moment and miss out on connection with other people and things like that.
But even with television, you can connect with other people because you can do a group watch and talk about it. But if you're each looking at your cell phone, you're little islands.
That can definitely happen, and it's sort of sad. What I think is most helpful when we think about mindfulness is to break it down into like the key components that are really helpful for people. So mindfulness is partially an exercise in attention. It's basically in focusing on the present moment. It's also a change in our attitude and the way we relate to our experiences. So if you read things from like the Dalai Lama or from like John Kabat-Zinn or some of the other people who've been pretty influential in our ways of practicing mindfulness today. They talk a lot about curiosity and openness to our experience, a non-judgmental awareness. I think a few of you talked about being calm, being aware, being present. This idea that we're really engaging in observing what's happening and trying not to do so in a way that closes us off from our experience. John Kabat-Zinn says it's an open-hearted, moment-to-moment, non-judgmental awareness, which I think is a pretty good definition of what we're trying to do when we're becoming mindful. The one significant addition to that I think we need to remember is that mindfulness also includes a posture of compassion, and we're going to talk about why that is and also how that helps us both physically and mentally in just a moment. But the basic idea of compassion is that we would be aware of things, including things that are painful or that cause suffering in our lives, and that it teaches us to basically want to alleviate that. We might not do something all the time that fixes it or takes it away, but at least we have the desire to do something that's helpful or beneficial for ourselves or other people who are suffering. And that attitude makes a big difference when we talk about the harder parts of mindfulness. I think
Where calmness turns into peace. To me, I've been sitting here contemplating on opposite peace. Because that seems like, I feel like there's a little bit of a rush with the term peace.
Yeah.
More settling.
Mm-hmm.
That would be if you can't do anything, but you have, or if you can, maybe that even makes it peace.
Yeah. So I think you're absolutely right. And mindfulness itself, especially in its like common culture, sort of the way it is today, where it's like stuck in apps, which I use an app for mindfulness. I love my mindfulness app. But when it's like condensed down into these 5-minute, like breathe and you'll have a better day, we end up just with calmness a lot of times. And it doesn't take us all the way to peace. And peace does come with some of the deeper levels of acceptance and compassion. And I think those things do move us to that deeper experience that's one step past just being calm. I think Lori mentioned earlier that mindfulness is not just meditation. Like meditation's a skill. It's probably one of the ones that we think of a lot when we think of mindfulness. But mindfulness goes a lot beyond that. And so we'll talk about a couple ways to do that as well. Things that mindfulness is not. If you think about the word mindfulness, it's actually like mind, then the word full, and ness. So mindfulness is about having your mental space full of a present moment awareness. Well, a lot of times we live without meaning to, is mindlessness, which is sort of the opposite. We live on autopilot. We're just going through, checking off tasks. We're thinking about other things, what we have coming up next. Maybe we're worried or anxious about something, something that might be going wrong in a family member's life, or something that's taking us out of the present. And then we become really separate from our experience. We don't need, and I think this is important to know because a lot of people, when they talk about mindfulness, they think that they're inherently bad at it, which in a way we all are, but in another sense we're not. I think a lot of people expect to get to this sort of Zen-like state of an empty-minded blankness where you're just very peaceful. And mindfulness doesn't have to include that. It actually happens when our minds are pretty busy. They're just focused. They're directed rather than being aimless and wandering. So I think that can also help. So I've talked a little bit about what mindfulness is or the qualities that make it there, but why do it? And in our culture today, we think usually about the pursuit of happiness and maybe the pursuit of peace. These are the reasons that a lot of people come up with. And they're pretty good reasons. I mean, as a therapist, I can tell you I've never had someone come into my office and tell me, Dr. Andrews, what I really don't want, I just don't want to be happy and I don't want to have any peace. I think if we wanted to have a miserable, difficult life, we could all figure out ways pretty quickly to do that. What a lot of us want is that happiness and that peace. So it makes sense that we would chase mindfulness for those purposes. The challenge of that is that it can leave us in a little bit of a bind, because mindfulness is actually one of the best things about mindfulness is it's a posture that helps us in times when we don't necessarily have the things that we want. Mindfulness was really developed, its oldest roots are in a lot of Buddhist philosophy, and the idea around Buddha's early teachings was that people are suffering and we experience pain, and we can't really avoid that. I imagine that every one of you here, and I know I have, has been through really hard times at some point in life. You've been through seasons where things were really difficult. Possibly every day you have something happen that you wish didn't happen or that causes some form of discomfort. Physically, perhaps you have some sort of chronic pain or maybe just I know so many people who have some sort of back pain, or they have a pain in their legs or their joints, arthritis, so many things that affect us where they interrupt our peace. And mindfulness is a lot about how we respond to that in a way that helps us maintain some peace rather than having to exist in a world where nothing goes wrong. I think that's really, really helpful. When bad things happen to us, things we don't like, or things that are just uncomfortable or unpleasant, we usually have a few options. So one is we can just try to avoid it. And this was my default strategy for a long time. Like, I can tune out, right? I talked about TV earlier. Netflix is a great tool for tuning out. Like, I can just, if I'm unhappy, like, I'll watch a show and forget that I'm unhappy for a while. The problem is, I don't know if any of you have tried that, but it doesn't really work, because once the show ends, you still have to deal with life. And not only does it not work, but you just lost a lot of time. You can lose hours of time that you could have used to do something meaningful, and instead you lost them on some show you really didn't even like or care about just because you didn't want to think about whatever was bothering you. And I've done that more times than I would like to admit. Doesn't work. Another option that we have, and I think all of us have probably done this, and definitely all of us can think of someone who's done this, when something goes wrong or something's really troublesome, we can just deny it, live in denial. Like, that's not happening, that's not there. If I close my eyes and think about something else, it'll just go away. And of course, that also doesn't work. I see that with people all the time who want to believe that life is really different than it is, and they struggle with accepting some part of reality, but it doesn't make it less real or less true for them. The last thing that we can do, or a lot of us try to do, is try to control it. And if we have some agency and there's something we can do to make life different, that can work sometimes. But if we can't, I don't know if anyone here has ever tried to control something that's out of your control. By definition, doesn't work, and it's maddening. There's nothing more frustrating than trying to spend all your time and energy making something different when you can't control it, because by definition, nothing changes. It's like spend your whole time trying to get someone to make a wise decision, like a spouse or a family member, someone that you want to be smarter than they are, and for some reason they keep making the decision you wish they wouldn't make, and you can drive yourself nuts trying to make it different. So we need an alternative, and that alternative, the alternative to avoiding pain and to trying to control things that are outside of our control, trying to live in denial, the alternative is really mindfulness, and it gives us a way to move forward. Wait, let's go. There we go. Okay, so there are some real benefits that come when we're mindful. The first one is access to our values. If you think of the things that cause you maybe a lot of emotional pain in life, almost all of them are because they're really important to you in some way. Like, I've never had my feelings hurt because someone who is a bagging grocer said something unkind to me, because the truth is I don't care very much what they think of me. But if someone who I really respect says, like, Ben, you're a jerk, and you're selfish, and you're overly self-absorbed and focused on you, I'm going to take that home, and it's going to hurt. If someone says that to me that I don't know, I'll shrug it off and be like, whatever, that's fine, you can do that. Or if I lose a job that I don't want, I don't care. Like, I didn't want that job anyway. But if I lose one that really matters to me, then it's painful. The key here is that the things that are our emotions around pain, things that make us feel sad, things that worry us, give us anxiety, those are actually pathways to tell us what's most important in our minds and in our hearts. They're the things that really matter to us. So if I really grieve over something, that's because it was important. And the only way not to feel those really hard feelings is to remove the things that really matter from my life, which is not something any of us really want to do. We want to have a meaningful life. So mindfulness lets us connect to our values. When we're aware, I think someone mentioned this earlier, when you're aware of yourself and possibly aware of others, you can actually connect much more deeply. So many of us have had times probably where you agreed to do something and then realized later you didn't want to do it, but you weren't aware of it in the moment. You were like, oh, I'll do that, sure, whatever. And then you end up doing it and you're like, oh my gosh, why did I tell that person yes? I don't want to do this at all. Or other times where maybe you said, no, I don't want to do that, and then you ended up realizing later that it mattered more to you than you thought. Those moments, if we're aware of them, they let us make a different decision in the moment, and then we can deepen our connection with other people. And the last one that I think is really good is increasing our openness to life and deepening our spiritual connection. When we're moving a little more slowly, when we're more open, when we're more aware of what's happening, we can have a much deeper experience of life, of our connection with people, of transcendence. We become a lot more whole in many ways, or at least aware of our wholeness. And that makes life much, much more rich. As I mentioned earlier, we can't really avoid negative experiences very well. So if you're trying to practice mindfulness just to do that, it might work a little bit, like you might feel a little happier temporarily, but it won't give you the same sense of peace that you can get when you really get into it. There's a lot of interesting research out there. We need to do a lot more, but we're doing a whole lot of research. And research shows us that mindfulness has tons of benefits, not just at the abstract level, but in the concrete levels. So first, it can actually lower your systolic blood pressure, which is really good, especially if you have some form of hypertension or you're dealing with some medical problems related to your heart or blood pressure. That can be useful. There's not enough for us to know for sure, but there's some limited evidence that says that mindfulness can either help people reduce the incidence of strokes or of TIAs, or help people recover some afterwards. There's a lot of evidence that shows that it improves our attention, substantially improves our attention. And actually, in improving our attention, that can lead to some positive developments for memory, which is a really good thing. There's some evidence that says that it can be helpful for people who have Alzheimer's or who have dementia. Really, what's probably happening there is our memories are impacted by a lot of different things. And I don't know, if you're anything like me, if you're stressed out, your memory will get a little bit, temporarily a little bit worse. If we're actually, the same thing can happen if you're feeling really sad or really down, your memory can decline. There are a lot of different factors that can affect our memory. And so mindfulness probably it's not going to like reverse the effects of Alzheimer's, but it is going to help us not have any other factors impacting our memory. So our memories will do better despite having Alzheimer's or something like that, having a dementia. And so that's really helpful because it can help us slow down what's happening and make the most of our life. There's some evidence, and again, here it's mixed, but that practicing mindfulness is helpful for people with diabetes, can improve outcomes, potentially with blood sugars and also with blood pressure for people with type 1 and type 2 diabetes. And then there's a whole lot of evidence that mindfulness reduces pain levels. It will not completely take away your pain, but there's a lot of research that shows that mindfulness can help you experience a lot less pain and be unimpeded by the pain that you have. Yes?
What about sleep disorders?
Sleep disorders, great question. So mindfulness is useful for sleep. I actually use it a fair amount with sleep. Mindfulness alone usually won't do everything. There are some other things that need to happen. One of the things that's really interesting is a lot of the research shows that medications are useful for sleep in the short term, but in the long term, they wear off. And so if you've been on something like Ambien or something like that for many years, for at least for a lot of people, maybe not everyone, but the effectiveness will start to wear off. And so something like mindfulness is a great tool when you're combining it with medications or combining it with some sleep hygiene is the word I'm looking for. Sorry. I have not had tons of sleep lately, and so my brain's firing a little slower than I would like. When you combine it with sleep hygiene, it can be really helpful. There's also, if anyone is interested, unfortunately, I'm not a specialist in this, but you can find someone who practices something called cognitive behavior therapy specifically for insomnia. And mindfulness is a big part of that. It's a big component of it, and that is shown to be pretty effective for helping people sleep better. So that's a great question. Thank you. Let's see. Now, I'll talk briefly about how this works. Mindfulness, I think, because it's such often associated with a contemplative, more a contemplative approach to life, more meditation. Sometimes we think of like Buddhist monks or some sort of monastic kind of mystical approach. We can give it a little bit of a magic wand quality of like whatever you touch with mindfulness will turn to gold. Just do mindfulness and it'll get better. And the reality is it's not magic, but it has a lot of really basic biological factors that it helps with. So if you think of your mind and your body, we know that they're always related. Does anybody get hangry? Like you get irritated when you're hungry? I do. I also get irritated if I'm really tired, and I'm seeing that firsthand with my child, who, when she's overtired, starts to scream and cry a lot. If you've ever felt anxious before, which is a normal human experience, your heart beats faster, you might sweat a little bit. If you're nervous about something or you've got something on your mind, you might feel more tense. And actually, that's your body trying to prime you to perform at its highest. It's trying to push you towards peak performance, which is great up to a point. And then it's like, this is uncomfortable. I don't want to feel all this anxiety. But what happens is our emotional state and our physical state are always linked. So if we're feeling nervous, we feel that physical arousal. If we're hungry, conversely, like that's a biological state, that can impact our mood and how we're feeling emotionally. And so there's this give and take. What mindfulness does is it actually uses the body as the starting point. Instead of like traditional talk therapy, right? You talk about your feelings, you gain some insight. That kind of starts with your emotions and with your thoughts and then hopes that your body will catch up to it and you'll feel better. Mindfulness kind of does the opposite, and it starts with how you're feeling physically and then lets that trick your mind into thinking that you're better. And it works. It works really well. You can do this with little things like there's research that actually shows that if you smile, you feel happier, and it tricks your mind, and it's great. The same thing happens with breathing. So your mind, it's like any other sort of muscle. It needs oxygen, and the use of oxygen is what enables us to like tense our muscles. It's what keeps our brain functioning. So when we're controlling our breathing, which is a central part of almost all mindful practices, not everyone, but most of them, when we regulate our breathing, we're actually regulating the amount of oxygen that our body has, which forces our body to calm down. And when our bodies calm down, our whole being actually comes into alignment. And so you can, obviously, don't hold your breath for too long. Like, you need to breathe to live. But if you slow it down, you slow your pace of thinking down, you slow your pace of feeling down, your body relaxes, and you actually experience some of the calmness and relief that you can get. Come on. When it comes to just mental and emotional health specifically, there's tons of research that shows that mindfulness helps with depression. It helps a whole lot with anxiety. We can use it to treat addiction. We can use it for general stress. We can definitely use it for sleep, as someone mentioned. There are all sorts of things that benefit as we really connect with our experience, pay attention to the things that matter to us, and regain our ability to move in life and to, I think, so often our life decisions are motivated by how we're feeling without us even being aware of how we're feeling a lot of the time. And mindfulness helps us slow that process down, which ends up having huge benefits for almost all of our mental and emotional health. Let's see, a couple of other things here. Yeah, so mindful breathing shows reduced activity in a part of your brain called the amygdala. You don't really need to know this, there's not a quiz, but the amygdala is a part of your brain that's responsible typically for emotions that people don't like. So like fear, anger, really intense feelings. The more active your amygdala is, the more strongly you're likely to be feeling those. So this calms your amygdala down, and then it helps you use your prefrontal cortex, which is the part of your brain that's responsible for using a lot of thinking and your rational mind, and so it gives you a lot more agency and control, so you're less likely to be hijacked by what you're feeling. Another major part of this is something called diffusion, which basically just involves becoming distanced from your thoughts. I like to compare this, it's a fancy psychology term, but it's like watching a movie, and this is the perfect time for it. It's Halloween, so I don't know if any of you have noticed on TV, but all of the horror films are coming on like every channel that there is right now. Now, I hate horror films because I hate being scared. I don't enjoy it at all, but I know some people love them. And the interesting thing about it is none of them are scared. And the reason is because it's not real. It's just a movie, and we know that, and we can go about our day. That's a metaphor for what diffusion is. Diffusion is the ability to step out of your thinking so that you can see it as just a thought, like just a movie. It's just a story that I'm telling me. So if I'm really worried and I'm like, oh, this is going to go wrong, and this is going to go wrong, and then this bad thing's going to happen. I used to talk to college students, and they would be like, I'm going to do terrible on this test. I'm like, okay, it's a test. No, I'll get a bad grade in the class. That's one class. If I don't get a good grade in the class, I'm not going to get a good internship. And if I can't get a good internship, I won't get a good job. If I don't get a good job, I'm going to be poor. And then my life, and they're like suddenly going from one little class to like their life is over, right? So they're playing this movie in their mind about how their life is going to end, instead of being able to step out of it and be like, oh, that's not real. I have one test. I can do this. Diffusion's about the ability to step out of our thinking. Finally, it creates compassion for ourselves and for others, and it creates acceptance of realities that we can't change. And that's also really key, because some things happen and we can't change them. In fact, that's when mindfulness is probably most important, is to be able to be empathic with ourselves and really experience ourselves when we feel like we're not able to make things the way we want them to be. We can find peace in doing this. So I want to probably, does that make sense? Just the general idea here of what's happening? Okay. I want to open up some time for questions, just to see where people are at. And then we might do one quick thing before we wrap up. But I also know, do you have time? Okay, yeah. So are there questions or things that I can answer for people about mindfulness or how it works or what we do with it? Mm-hmm.
Are there free sources of learning how to meditate?
Great question. So there are some free sources. One of them, there's a phone app called Insight Timer, which has a mix of free resources and resources that you can pay for, either one. But it has some free resources out there that you can use for trying to practice mindfulness. There are a lot of, like if you get lost on YouTube or something, you can get lost in hundreds of hours of different videos from different people talking about it. I think, actually, so I don't know about anything. Are there places around the campus here where people could like go if they wanted to intentionally focus on meditating or practicing mindfulness on purpose in a dedicated environment? Yeah. Mm-hmm. Yeah. Hmm? Sure.
And the chapel, that tends to bring the religiosity into it.
Mm-hmm.
I find most people think this is too generic terms.
Sure.
Yoga, mindfulness, I'm not sure about that. Christianity,
Yeah.
not the same thing. Whereas that kind of would give you the feeling of being more of Christianity.
Mm-hmm. Yeah.
So no, there is no, I don't feel there is any.
Yeah. So there may not be there's not like a room dedicated just to mindfulness. But
Open rooms, I guess you could go
yeah.
and dedicate it yourself.
Mm-hmm. Yeah.
You almost have to reserve that.
And I actually think that there is some importance to that because so we can distinguish between like informal and formal mindfulness. But in informal mindfulness is just being like aware of the present moment. You can literally, actually a great place to be mindful is brushing your teeth. And the reason for this is that so many of your senses are active. You can really be present. So right now, most of us are like probably about half mindful-ish. I don't even know why I say half, but most of us aren't aware. Like, for example, you probably haven't paid too much attention to what it's like to be wearing your clothes. Like, I sure haven't. I forgot that I'm even wearing a jacket or a shirt. I don't pay attention to what my body's feeling, but that's part of the present moment. Like, right now, I'm breathing. I can feel my shirt if I want to. I can feel my ring. I can really ground myself in the present moment, which is part of an informal mindful practice of just being aware. And so you can dedicate literally anything, washing dishes, brushing your teeth, and feeling the bristles and tasting the toothpaste and focusing on the intentionality of the movement. Like, you can do so much in these little moments for mindfulness.
The biggest place we have is the outside.
Yeah.
The forest, bathing, is probably
Mm-hmm.
you stay away from the people with the lawnmowers.
Sure. Yeah. Those things.
For everybody, it's not dedicated to
Mm-hmm. Yeah.
Our best place, in my opinion, is the environment outside. That the Japanese have developed forest bathing, they call it, just walking in nature. And if you can stay away from the yard people, it's free, it's very much non-intrusive.
Mm-hmm.
So that's the best place around here in my opinion.
Yeah. Yeah.
Or your balcony.
Sure. Balconies are good. I think I'll get you in just a second. I want to say one other thing on this. So for most of us, especially when we're trying to practice and learning, places that are restful or peaceful are preferred. It's easier. It's actually also much easier to go through mindfulness with a guide if you're doing formal mindfulness. So someone to kind of talk you through it. And the reason for that is our minds tend to wander. And so we'll get distracted and brain will wander off. And it's really nice to have someone who's just every 30 seconds or a minute saying, pay attention to this, focus on that. Feel this part of your breathing. Like it can help you focus more. However, I do think that mindfulness can be practiced. Like there's, I don't know, like easy mindfulness and really hard mindfulness. Hard mindfulness can be done with unpleasant, irritating things too, like a lawn person. Or my least favorite is, but I do this with people sometimes, is to find that part of your body that's itchy. We all have one somewhere where it's like, oh, and then just not scratch it. And you just pay attention to it and get really present to an itchiness. And it's not fun, but it's a way of learning to step out and observe something without having to get away from the discomfort right away, which is part of what being present's about. All right, you had a question too.
I was just going to say, we have a small chapel here.
Mm-hmm.
Seldom has anybody in it.
Yeah.
And it's just a wonderful place. I don't use it, but I would think about
Yeah.
a place like that.
Mm-hmm. Yeah.
Like in the hospitals, they have
They have similar, chapels, and even like airports and things will have something like that often. There are also a lot of related, like similar practices. They're not mindfulness. Yeah, please feel free to, if you all need to go, you're welcome to go. I will not be offended. But there are a lot of religious and spiritual practices that do incorporate parts of mindfulness. Just if we think about being present, mindfulness is that idea that we're present and focused on what's happening, especially internally. So there are a lot of forms of prayer, like actually the Orthodox and Catholic traditions in Christianity have a lot more of this than Protestant traditions, but some Protestant traditions have some too that can use it. Certainly, Jewish faith has some of this. There's a lot of opportunities for using religious space in a mindful way. So those can be helpful also. But mindfulness doesn't have to be religious, but it can be. So, yeah. Mm-hmm.
Isn't mindfulness connected to depression?
It can help us feel less depressed. It is a good practice. So mindfulness is probably, for depression, it's one component of helping people move forward. A lot of times when we're depressed, we become disconnected from a lot of the things that make life feel good, like our relationships. People, and I'd say this is, I don't know if this is a random factoid that no one needs to know. Before COVID, 46% of people in America would seek treatment for depression or anxiety at some time in their life. I can guarantee you, I don't know what the numbers are, but after COVID, that number's a lot higher. It's actually fairly normal to feel some sort of anxiety or some sort of depression. And when we feel really down, one of the things that happens is we lose energy and we become disconnected from the things that we enjoy, like people that we love or care about we spend less time with, or we don't feel connected. We feel like they're there, but we're not really connecting. And then we can get a little bit sunk into ourselves. And mindfulness, both with compassion, but also just being aware of what's happening, helps us move back towards what we really care about, which is one of the reasons why it helps with depression.
Well, I feel that I am getting depressed more than, a lot. Just look at Israel. What's happened. I can get very depressed about it, and yet I cannot do anything that I know that I can get over.
Yeah.
And the same is true with sickness, with operations and stuff in your family.
Mm-hmm.
And I can get depressed and not know anything to do about it.
Yeah. So one of the things that, specifically in terms of mindfulness that's there, we didn't really talk about this, but there's three types of common, like, mindful practice. One is focused attention, which is about, like, paying attention to your breathing or something like that. One is called open monitoring, which is more like, instead of being focused on one thing, we sort of pay attention to as much as we can and adopt a receptive stance towards our environment and ourselves and just notice what's happening. And then the last is loving kindness and compassion. And if you adopt a religious perspective on mindfulness, then you can incorporate prayer. as something people can do. But even for people who aren't religious, I've talked to a lot of practitioners of mindfulness who just talk about holding a wish, a kind wish for someone. They'll say, like, I wish that people didn't have to suffer that way, or even towards themselves. Like, I wish this wasn't happening this way right now. And the woman I'm thinking of is Kristen Neff. She's out in California and does a lot on this, a lot of research on this, and talks about basically compassion being fundamentally awareness of some sort of pain or suffering in the world. So compassion literally means to suffer with. That's like passion comes from Greek, and it means suffering, and calm means with. It's to suffer with. So compassion is about identifying or being aware of some sort of suffering or pain, recognizing that it's human and that the people that are suffering are human, and I'm also human, and so we're participating in a human experience, and then having this kind wish for, like, I wish I could do something for your suffering. And sometimes we can't, but at minimum, we can allow ourselves to feel it because it matters, rather than just doing what a lot of us want to do, which is to turn it off and tune it out. Okay, yeah.
Is very depressed.
Mm-hmm.
She's gotten so she cannot function that I do.
Yeah.
Is there any help at Springmore for that?
Mm-hmm. Yeah, so I meet with people regularly who are feeling either anxious or depressed or having some sort of problem, and then there are also there's also a lot of medications. Sometimes it takes a while to find the right one. Like medication is an art still as much as a science, but there are things that are helpful, and if you do both at the same time, it can help people move forward. Then, yeah, if they're not in the health center, then they would probably want to talk to their doctor about getting that. And they could still ask. So I see people who are not in the health center, but they would have to get, they just need to tell someone, like, in the health center that they would want to find me. And unfortunately, we're almost out of time, but we might have time for one more question if someone needs it or would like it. Well, thank you all so much for being here. It's really a privilege for me to be here with you guys, and I really appreciate your time, your attention, and I hope that all of you are able to enjoy some mindfulness. We didn't have the time I hoped for to jump into some, but it can really be a very, very enjoyable experience, and ultimately, mindfulness is something that you learn by doing. It's not something like I can talk about it abstractly, but it's something that we learn by doing and experiencing. So I would really encourage you to try. If you have time, you can try there are like free trial subscriptions to different apps. A lot of apps will require $5 to $10 a month if you want to keep them active and get access to everything. But there are some really good ones, like Headspace is one. There's an app just called Calm, and there's another called 10% Happier. And these are great, easy ways to get introduced to mindfulness and learn a lot and actually benefit a lot from what's happening. So thank you guys so much. I really appreciate it. Yeah.
Next week, Carrie Ritchie will be talking about the physical part of related to mindfulness, correct? Is there anything you want to say? Come and join us and bring a friend. And on the back of your sheets, there are some free resources. And I don't know if the UCLA has some free downloads. The UCLA Health website has some mindful practices too. So
That's actually a great resource.
So we'll look forward to seeing you all next week. Thank you.